Hello, my name is Brian Casey, editor-in-chief of AmpMini.com, and we're here at the 2019 edition of the RSNA meeting in Chicago. We have with us right now Dr. Amy Patel of the University of Missouri, Kansas City. Dr. Patel has been very active in the issue of attracting more women into radiology and also the RADxx movement. Dr. Patel, thanks for being with us.
Thank you for having me.
So, Dr. Patel, uh, some of the statistics that I've heard indicate that over 50% of women, of female medical students or over 50% of women are medical students, but that number drops pretty dramatically when they're picking a specialty in radiology. Why do you think that is?
Well, I think that there are still, unfortunately, a lot of misconceptions around the field of radiology. I think that we still have the perception that it's a very male-dominated specialty. Each year, we're, teetering around 27 to 29%. Are actually matching female-wise into radiology. We have that perception it's male-dominated, so perhaps there's the perception that females in the field aren't supported. But there's a huge, he for she movement in the field of radiology that debunks that stereotype. There's also misconceptions around radiation exposure, particularly when you're pregnant, that there, is maybe a harmful amount of radiation being exposed to the mother and the baby, which is absolutely a misconception as well. There's also misconceptions about, that perhaps if a woman wants to go into a field that's more patient friendly, that perhaps radiology is not patient friendly, that we're in our dark rooms all day. But there's so many subspecialties in radiology where we're interacting with patients on a constant basis. So I think it's really upon us as a field to really debunk these stereotypes and to show that this is a wonderful field, that women are very, very supported, and that you can really thrive in your medical career.
And I think what we've been seeing lately in radiology is a lot of women appointed to leadership positions. For example, the president this year of RSNA 2019 is Dr. Valerie Jackson. So I think that do you feel like we're making progress?
I think now more than ever, we are making progress. So Dr. Jackson is president. We have our first female chair of the American College of Radiology Board of Chancellors, Dr. Geraldine McGinty. We have the first editor-in-chief who is a female of the Journal of the American College of Radiology, Ruth Carlos. So we're really making leaps and bounds. And these women are wonderful. Not only have they been ascending in their own right, but they are supporting so many younger female radiologists, such as myself, to really help us propel to achieve what we want. So together, I think we're making quite, a lot of progress, and I think that we're only going to see this occur more and more in the years to come.
How much of an impact do you think that visibility is going to have on female medical students when they're thinking about picking a career, when they see women in leadership positions in radiology?
I think you hit the nail on the head. The word is visible. We as a field need to be visible. I recently published a manuscript that talks about how this is essentially radiology is the medical profession's best kept secret. And there's so many things that we can do to recruit women in the field. One of the things that I feel that we need to do is we need to push in medical schools for mandatory medical student rotations in radiology to expose women early, create those mentorship, sponsorship type of relationships. I also think that radiology residency programs need to take a more aggressive approach. We need to be establishing medical student interest groups for radiology for exposure for these women. And social media as well is a great way to reach women in the field and attract them. A lot of program directors and a lot of academicians are on Twitter to help promote the program, which can be a great recruitment tool for women and show that they're a very supportive residency program for women.
Okay. Now, can you talk a little bit about the RADxx movement, what that's about, and what you're hoping to achieve there?
Yes, so the RADxx movement was actually an amazing movement started by Dr. Geraldine McGinty and Umbra Health, where essentially it promotes the advancement of women leaders in imaging informatics and leadership in general. And it's really caught great steam. And tonight there's actually an event called Cocktails for Change, where both males and females are invited and where we celebrate achievements of women in informatics. So there's so many incredible things happening in the field of radiology for women, and we're all just very excited to be a part of it.
Great, that sounds great. Well, Dr. Patel, thanks for being with us.
Thank you.
Signing off for AmpMini.com, my name is Brian Casey.